Well, if you've dreamed of having a baby only to wake up one day to the nightmare of having trouble getting pregnant, infertility affects more than 7 million people in the United States, so you're certainly not alone. But thanks to science, more and more couples now have a chance at having children. And this morning, we're lucky to be joined by Dr. Dan Gehlbach, a board-certified reproductive endocrinologist, and Michelle Wilson, who's gone through fertility treatments. And these beautiful little girls are the result of that. So thank you both so much for being with us today. Let's talk first, because this can really be devastating to couples.
Yes, infertility is one of the big problems here in the United States. It affects at least 1 in 7 couples, and our desire to have children is one of the most important drives that we have. So
let's talk a little, because there's so much science now that can help couples. Talk about some of the specific treatments that you offer.
There's a number of treatments, and it's really based on the cause of the infertility. I'd say male factor affects almost half of the couples, so we do many treatments with inseminations, fertility drugs, sometimes in vitro fertilization. We see a lot of women who have trouble with ovulation, women with endometriosis. Age-related infertility is a very common problem now, and we see a lot of couples who don't start trying to have a baby
until
they're
having babies later.
Late 30s, early 40s.
This is IVF that we're seeing here?
Yes.
Okay, explain kind of what
we're seeing.
Process is.
This is an egg or oocyte. It's under the microscope. And right now, a procedure called ICSI, intracytoplasmic sperm injection, is being performed to fertilize the egg. So a single sperm is being injected into the egg to fertilize it.
Wow. All right, Michelle, you have Alexis on your lap.
Correct.
And this is Kelsey here. Tell us your story. How did fertility treatments change your world?
My husband and I, we were about 27 or 28 and decided let's have kids. And, you just think, in a couple months we'll be pregnant. And, we tried for a little bit over a year and we were like, oh, something's probably wrong yet. Our friends were getting pregnant and we weren't. So we went to Dr. Gehlbach and staff and just talked to them. We had a couple of tests done and everything checked out fine. So we pretty much had undiagnosed infertility, which is frustrating because how do you fix something when you don't really know what the problem is? So, we did a couple of different treatments with Dr. Gehlbach, and in about 9 to 10 months after starting with him, we got pregnant and found out we were having twins, which was amazing.
Wow, and you're a twin yourself.
Correct, I have a twin brother.
So is this your mom over
Yes.
here? And she said it brings back lots of memories seeing these two little ones.
That's my mom and my mother-in-law. I get a lot of help, luckily.
Oh, that's awesome. I asked her what it's like to have two, and these are her first, so she said she doesn't know any different.
Thank goodness.
Yeah, no kidding. I cannot stop. These legs are too cute. Chubby baby legs are the best. What type of blessing are these girls to your family?
They are great. They're about 11 months old now, so when we had them, it was great. You really appreciate everything when you've had some trouble conceiving.
Right.
And so, even when they're having a bad day, I always, I don't take them for granted ever because I'm so grateful to have them.
Very good. All right, advice for couples if they are struggling with becoming pregnant, with conceiving. How long should someone wait before they actually come to see a specialist like you?
It depends somewhat on their situation. For younger couples that don't have any known fertility problems, I think most couples try a year before they come in for treatment.
Okay.
But women over 35 probably should be in sooner, such as after 6 months. If there's something obviously wrong, if the husband has had a history of a low sperm count, if she's not having regular cycles, then there's no reason to wait. They should come in as soon as they're ready to get pregnant.
All right. And you can come home with cuties like these. Thank you guys, both of you, for being here today.
You bet.
If you'd like more information on infertility or fertility treatments, we've listed some of those resources on our website. You can go to fox4kc.com, click on air, and you can find everything there. Thanks again for being here.